Hello, my name is Michael David. I am a student at United States University, MSN 572, and right now I'm going to demonstrate the head, ears, eyes, and nose and throat examination. And I have Miss JD over here to help me with the examination. So before we start, I'm just going to have to ask if she would give me consent before we proceed. So Miss JD, are you giving me full consent before we can proceed with the examination under a recording?
Yes, I do.
Thank you very much. And before we proceed, we have to make sure that we disinfect our hands because we'll be doing a lot of palpation on this part. So if you have soap and water, that'd be great. Or you can also use a hand sanitizer for that as well. Okay. Right, so once we have finished with our hand sanitizing, we can now proceed to the inspection of the head. So with the head, we should inspect the hair distribution, and as well as check the hair to see if it's dry or thinning. But as you can see here, her hair appears to be soft and smooth, which is a good sign of healthy hair. And you can also inspect the whole head for any lesions, any scars, or any rashes. And she has none at the moment. And after that, you can now palpate the head and check for any growth, cysts, or depressions along the scalp. So just excuse me about this. Sorry about that. Just gonna check your head. So I haven't found any depressions or cysts on her head, so everything seems to be fine, and her head is also symmetrical. So now we can proceed inspecting the eyes. So at the moment, her eyes, her eyebrows also are okay. They're symmetrical. The hair distribution on her eyebrows are good. Check for her sclera. Sclera is actually white. It's not jaundiced or yellowish. Her eyelids are not showing any signs of droopiness or ptosis. Her eyes are also not bulging, which means she hasn't got any exophthalmos, which is a thyroid problem. They're not also sunken. And now you can proceed to checking also the eye itself by checking the conjunctiva to see the color and condition. So just pull the eyelids down and check for the color, check for any drainage, check for any signs of infection. The conjunctiva should be pink in color. It shouldn't be red. It shouldn't be pale. Her case, it's pink, so it's all good. And also check for her cornea and iris as well. Her corneas seem to be in good condition. There's no scratching, there's no redness. Her iris are both brown, and both her pupils are also symmetrical in shape. And check also for her tear ducts. Her tear ducts appear to be in good condition. They're not reddish, they're not watery, and there's no discharge as well. So now we can proceed checking for light accommodation. So you can actually take your ophthalmoscope and make sure the batteries are good. Check, open up with the brightest light that you can possibly manage. And when you hold the otoscope, make sure you hold it with the two fingers, which is the thumb and the forefinger, and use these three fingers to brace or put distance between the face and the ophthalmoscope so that it prevents any injury or unwanted contact from the face and the instrument. So before we do that, we're gonna shine some light on her eyes so we can check her pupils if they would react. There's two ways of doing it. One is direct by actually shining the light directly to the pupils and to check and see if they would react. So I'm gonna do direct shining first. So okay. All right. So both pupils reacted well to direct direct light, and now we can try and do consensual, which we're gonna shine the light from the side towards the front. So Okay. Straight. Okay. So again, both pupils reacted to the light coming from the side. So now we can check for the next one is to check for the range of motion or extraocular movements, muscles of the eyes, which is controlled by the cranial nerves, the oculomotor, the trochlear, and the abducens muscles. So what I'm going to do is ask the patient to look straight into my instrument over here. And we're going to check eye movements on all directions, mostly 6. So if you look at the center right at the moment, focus your eyes over here. And don't move your head, just follow with your eyes, okay?
Okay.
Yep. Okay. Okay. So all of the muscles, all the movements that we were looking for are there. She was able to move her eyes in all 6 directions as expected. Um, so now we're gonna check for nystagmus, which is like an involuntary movement of the eye when looking at something. So I'm gonna have to ask you to focus on my badge while I'm gonna turn your head and see if your eyes will diverge somewhere else, okay?
Okay.
So, sorry about this. Okay, very good. All right, so I didn't see any nystagmus there. Both of our eyes focused on my badge and they stayed focused even though I moved their head. So now we can proceed to the next test, which is going to be the convergence test. So I'm going to actually hold my ophthalmoscope, and I want you to focus on the head part of the ophthalmoscope, and I'm going to draw it near towards you, and I'm going to watch your pupils converge towards the end, okay?
Okay.
So here we go. Okay, so both of her eyes, pupils actually converged as I drew nearer, and that's a good thing. So that means that her control of her muscles are good. And next we're going to control. All we're going to do is the accommodation test, which we're going to check her pupils again and see for a reaction. But this time I want you to focus on that spot over there. Just focus on that spot. And I'm going to shine your eyes and check to see if your pupils react. With the accommodation, when you shine one eye, the other eye should also react, and with the reaction, the reactions should be the same as the one with the light shown. So we're going to check one eye at a time. So just focus over there. Just fix your focus. I'm going to check on your left eye first and see. Okay, the other one reacted, and now for the other eye. All right. So both eyes actually reacted to light, approximately 3 to 4 millimeters in size. So everything seems to be okay when it comes to the visual fields. So now we can actually check the actual eye itself, which is the fundus exam. We're going to check for red eye reflex for now. So I'm going to shine the light on her and check for the reflection of light from her eye. So look straight to me. Okay. All right. So that's red eye reflex. So now we're gonna check. Once we've checked the red eye reflex. We're gonna check to see if the cornea and the iris are okay, and check for foreign objects as well. So let's see. I'm just gonna check and see if there's any problems there. And so far, yep. Okay, so these areas are sharp, the pupils are okay, and now we can proceed to checking the actual retina itself and check the inside. We're going to do it in a way that's not going to be uncomfortable for each of us. So you're going to check her red eye with your red eye and your left eye with your left eye. So first we're going to turn the brightest light on. I'm going to take my glasses off because I can't see properly. So we're going to check first for the red reflex, and see. Then follow that red reflex and try to grow a bit closer. Again, watch your fingers and make sure that there's enough distance over there. And once you see it, you just move around until you find a comfortable spot and check on the retina. And I've seen the vessels over there, they're okay. The optic disc seems to be fine. I don't see any cotton wool spots. The optic cup is roughly between 4 to 8 centimeters from the optic disc itself. Okay, so now we'll try the other one as well. Sorry, not super. Okay, here you go. Sorry about that. I'm going to hold your head for now, okay?
Mm-hmm.
Okay. Right. So we've checked both eyes. The insides, there's no problem with the vessels. They seems to be okay. There's no other discoloration. There is no cotton wool spots. The optic disc and optic cup ratio is between 4 and 8 millimeters, because anything over than that could be a sign of glaucoma. So after that, now we can now proceed. Now that we're okay with the eye inspection, we can now proceed with the nose. So I'm going to put this otoscope down first. Otoscope. So next up the nose, we're going to inspect the nose first and see how it is. It's not enlarged. It's not. There's no rashes. There's no redness. So I'm gonna lightly palpate the nose and see if there's any problems with it. If it's broken. Okay. Is there any pain in there? It's not tender at all. So now we can use the our otoscope to check for the sinuses and mucosa inside. So I'm just going to change the head of this one. And we should also remember that when you use this, you should always be safe when handling the instruments, that it doesn't graze the patient's face. That makes them comfortable, and use a different probe every time you use it on a different part of the body. So first I'm going to use one probe for the nose. Okay, so we've checked the nose for everything. There's no discharge coming out at the moment, so we're going to check the insides of it and see if everything's fine. So I'm going to have to ask you to tilt your head up. I'm going to lift your nostrils a bit so I can see the insides, okay?
Mm-hmm.
So, okay, there we go. So the nostrils, the insides, the mucosal lining is pink. The turbinates are not blocked. Air appears to be freely flowing as I can feel her breath coming in and out of this nostril. And now we can check the other one as well. Right, same thing for this one. The mucosal lining is pink. There's no discharge or anything. The turbinates are unclogged. They're all clear. And like the other one, I can feel the airflow coming up that nose, which means it's not blocked. So yeah, her breathing is not exactly having a problem. How is your smelling at the moment? Can you smell stuff, or is your smell present at the moment?
It's okay. I can smell.
You can smell stuff. Okay, so her turbinates and her nose is actually patent. It's fine because it's functioning very well. So now that we're done with the nose, we didn't see any problems, we can now proceed to the ear. So we're going to actually put this down and change the probe. Okay, I've changed the probe, and as always, like I've said before, the way you treat with the instrument is make sure that there's no injury, or the instrument does not actually come in contact with the patient very closely, because it might actually harm them or it may be comfortable for them. So when you hold the otoscope, make sure you're holding it like a pen with your 2 fingers up, 2 fingers around it, and the rest of the fingers should be against the skin or on the face of the patient, so that there's some distance between the instrument and the face itself. So before we inspect the insides of the ear, we should do some tests to check for hearing. So the first test we're going to do is the whisper test. So I'm going to mention, I'm going to say a two-syllable word in each ear, and I want you to repeat after me if you hear it, okay?
Okay.
Okay.
7.
Very good. And the other ear?
20.
20. Very good. So she passed the whisper test. She heard what I said on each ear. So now we can proceed to the Weber's test, which requires the use of a tuning fork. So with the Weber's test, actually you hit the tuning fork to produce a sound, and then place it on the forehead and check to see if there's equal distribution of sound on both ears. So let's try it now. Can you hear on both sides equally?
Yes.
Okay. So she passed the Weber's test because she can hear on both sides equally, and none of it is louder than the other, right? Okay. Right. So now we proceed to the next one, which is going to be the rinse test, which we're going to check to see the difference between bone conduction and air conduction. With bone conduction, the sound is actually behind your ear, the mastoid bone, and you make sure that to pass the test, the sound you hear from bone conduction should be shorter than air conduction. So that's why we're going to test bone conduction first before we go to the air conduction. So we'll try it one ear at a time. So we're going to try the left ear first. So place it behind the ear, and let me know when the sound stops.
And stop.
You hear that?
Yeah. And stop.
Okay. So the left ear is okay. The air conduction is longer, so that will check the right ear.
And stop. And stop.
Okay, so the right is also working fine. The bone conduction was shorter than the air conduction, so she passed the rinse test. So we're done with that. Now before we proceed to the inner ear, I'm just going to check the outer ear first and check the pinna and make sure there's nothing wrong with it. So the pinna seems to be okay. It's not red, and I don't see any lesions there. So this pin is okay. The ear auricle. So same thing for this one. There's no skin discoloration, there's no lesions, and no discharge noted. So now we can proceed to check the inner ear with our otoscope. So two ways you can hold the otoscope is either hold it normally like this with 2 or 3 fingers sticking out to make some distance from the face and the instrument, or you can do it upside down, holding it the same way. So we're going to check the insides of the ear, checking the ear canal and the eardrum, and see if they're okay. So we'll start first with the right ear. So I'm going to put it upside down again because that's the way I like it. Okay, so when you check the adult's ear, you have to pull the pinna up and back. For children, it's going to be pull it down and back. So carefully slide it in. And for the right ear, when you check the eardrum, check for the color, which is going to be pearly gray or pearly white, and the cone of light should be at 5 o'clock, which is showing right now. And the landmarks you're going to see are the malleus and the umbo, which is also present here, and the ear canal seems to be intact and not impacted and pinkish in color. So that's good. Now I'm going to do for the left ear. So sorry, I'll use the other arm. I'm a right-handed guy, sorry about that. So I'm going to pull and draw it back. So I'm going to do this. Okay, there we go, I can see it. So the same thing, the canal is clear, pinkish. The cone of light is at 7 o'clock this time. The eardrum is pearly gray, and the landmarks are there, which is the malleus and the umbo. And everything seems to be fine on this ear too. Okay. So now we're done with the ear. We can now proceed to the next part, which is going to be, we're going to be inspecting the mouth. And I'm going to leave the, let's go there for a moment. So with the mouth, you're going to inspect the lips first and see if there's any cracking, there's any bleeding, any lesions. I don't see anything at the moment. And now I'm going to check inside of the oral mucosa and see what the color it is and how it looks like. So I want you to say, open your mouth at the moment. Okay. Open up, open. I'm going to use again the otoscope and we'll use it as a flashlight. I'm not going to go too close to her. I'm just going to check the insides of it. So say ah. Okay. Right. The oral mucosa is moist and pink with no problems. The tongue is the same thing. It's moist and pink. I don't see any lesions or anything like that. Her teeth appear to be fine. I don't see any cavities at all. We're going to have to make sure that the patient actually goes yearly checkups on with the dentist to keep. You can close your mouth now. Sorry. They have to keep their yearly visits with the dentist to make sure that their teeth and gums are healthy. And let me check your gums. I'm sorry. I'm just going to check your gums and make sure they're okay. Yeah, the gingiva seems to be nice and pink and healthy and not bleeding at all. And open up your mouth again. Can you lift up your tongue for me? Okay. How about side to side? Very good. So her tongue muscles appear to be working fine. They have no problems with the tongue, right? It's not. It's not dry or cracked. It's not swollen. And now we're going to check the palate and the uvula and see how it goes. Open up wide for me, please. Right, the palate seems to be clean. And stick out your tongue. Thank you. And say ah. There we go. And the uvula is actually in the center. The palate is actually pink. And it's not erythema. There's no erythema noted. Okay, close your mouth now. And when she said ah, it actually opened up her pharynx. Her pharynx seems to be okay. There's no cobblestoning or anything. No erythema either. Can you try swallowing? Do you have any problem swallowing at all? No. So her swallow is okay. Her tonsils, when I checked the inside, her tonsils were not inflamed at all. They were actually close to the pillars, so she has no problems of tonsillitis or whatever. So we're done with the mouth and throat. We can now proceed with the neck. So I'm going to put this down again. And this time I'm going to check the neck for any discolorations around the neck area, which is nothing around there. So the skin around the neck seems to be the same. There is no sign of any rashes or any physical signs of any lumps or growth. So now we're going to check the range of motion on the neck and see if it's working fine. So I want you to turn your head from side to side. Okay. No pain. Everything's fine. Okay. I want you to extend and flex your head. Okay. All right. Flex your head. All right. Very good. Any problems at all? Okay. I want you to tilt your head from side to side. Very good. So the range of motions on the head seems to be okay. She's able to move it from any direction without problems whatsoever. And we're going to check and see her trapezius muscles by asking her to do a shoulder shrug and see if the trapezius is fine. So can you shrug your shoulders for me, please? Okay. Any problems with that? No pain whatsoever? Very good. So her trapezius muscles and her shoulder seems to be fine. So now we're going to test for her sternocleidomastoid muscle to see if it's working okay by checking for head turn resistance. So I'm going to place my hand on your head and I want you to resist if I push a bit, try to resist and see how things are going, okay? So I'm going to place my hand on your forehead and push back and try to push back. Very good. Now side to side. Now try to push my hand back. Okay, that's good strength. This side. All right, very good. So her SEM muscle seems to be in a very good condition because there's very good strength when she was resisting my hands when I was holding her head. So everything there seems to be fine. So the next one now we're going to check is for any swollen lymph nodes, which are all over the head anyway. So the first lymph nodes we're going to check is going to be the one next to the ear, which is the auricle ones. There's one in front of the ear, and there's one behind the ear. So we're going to check those first. So with the pads of your fingers, preferably 2 or 3 fingers on each hand, just palpate and try to do a circular motion on each side and see if you can palpate any nodules just about the size of a pea. And there's nothing there on the pre-auricle one. Now we check for the one behind the ear, which is the post-auricle one. Okay, there's nothing there. So now we can now check next lymph nodes we're going to check are the cervical ones, which is going to be the anterior and the posterior one. So the anterior cervical lymph nodes are located right under the jaw over here. So there's no lymph nodes over there, no swollen lymph nodes. Everything's fine. The next lymph nodes will be the posterior cervical, which is found behind the SCM, which is going to be on these sides over here. Okay, I didn't feel any nodules there or nodes or any growth that's worth mentioning, so that's fine. The next one is going to next lymph node we're going to check is the submandibular one, which is just underneath the jaw. So I'm going to check the submandibular lymph nodes over here underneath the jaw. And like the others, there is no growth or mass that's felt, so that's fine. And then we proceed down to the chin. Under the chin is going to be the submental lymph node. So we're going to check it as well. And like the others, there's no growth felt, so there's nothing palpable over there. So the next one is going to check is the supraclavicular lymph nodes, which is just above the clavicles. So just look for the clavicles and then palpate just above them. And I don't feel any palpable masses there, so everything is okay. And then the last lymph node that we're going to check is going to be the occipital lymph node, which is located just behind the neck. So just go check behind the neck and see. Okay, there's no palpable mass as well. Right, now we're going to check the trachea and see if the trachea is actually in place. It's not deviated or anything, so just feel the trachea just in here. There's going to be the soft part of the neck, and you see if you can try to move it on side to side, see how flexible it is. And in her case, yes, it is flexible and it stays in the middle. So far the trachea is fine, it's in place. And now we can proceed and check the thyroid glands. Thyroid glands, we can check it in two ways. You can check it standing in front. All you have to do is just feel the isthmus of the thyroid gland in front, and check to see if there is any swelling, any signs of swelling. Ask the patient to swallow so that you can actually feel where the isthmus is. So can you swallow for me, please? There we go. So it doesn't seem to be swollen. Okay. And the other way is to actually stand behind the patient, and you can palpate it using your 2 hands. And the same thing, ask the patient to swallow to see, so you can find the isthmus of the thyroid, and you can check from there. So swallow for me, please. There it is. Okay. Okay. It doesn't seem to be swollen. So we check the thyroids for swelling because it could indicate thyroiditis or problems like goiter. which definitely need to be addressed by a doctor. Um, so for now, we were done with the examination. Um, Everything seems to be fine with Miss JD over here. I didn't find any unusual mass or unusual lesions, unusual swelling in her, so everything seems to be fine. She seems to be fine and healthy. So thank you very much, Miss JD, for your participation, and thank you very much also for watching, and I hope to catch you next time. Thank you very much.